Hello, my name is Dr. Zui Bagul. I'm a practicing neurologist at B&J Hospital, Kamote, Navi Mumbai. Today we'll discuss something about stroke. So a stroke is a brain attack in which there is a sudden event causing damage to a part of the brain. This may be either due to a blockage in the blood vessel in the brain or due to bleeding from a blood vessel causing damage to the part. Okay, so why do we need to know about stroke? This is because stroke is very common. At least 3 people suffer from stroke every minute in India, and in your lifetime you may meet someone who is suffering from stroke, or it may even be a family member who will need your help in this case. Okay, so your knowledge can help this person in that it may save his life or even reduce the disability. There are 2 types of stroke. The first type, which doctors call as ischemic stroke, is a blockage in a blood vessel. Due to this, blood and oxygen is unable to reach that part of the brain and it gets damaged. The second type is hemorrhagic stroke, in which because of some weakness in the blood vessel, it bursts, the blood leaks out and there is damage to that part. Okay, so how do you recognize stroke? Most strokes are actually easy to recognize even by a layperson on the street. So first type, there will be a loss of power or sensation on one side of the body. So if suddenly someone is unable to move one hand or leg, that person may be suffering from stroke. In the second type, there will be a difficulty in the speech. So suddenly the person may be unable to speak at all and be confused, or they may have a change in their speech such that you cannot understand what they are saying. In the third type, the person may experience extreme dizziness and loss of balance, so they will be unable to walk. And in the fourth type, they may experience extreme severe headache which they have not experienced before. So if you see any person who has suffered from this, then you have to bring that person to the hospital immediately. The faster you bring to the hospital, the better it is for the doctors to save that person's life. Okay, so once you bring your patient to the hospital, what can you expect? Okay, so immediately the doctor will ask for an emergency CT scan or other brain imaging. From this, we will be able to make out whether there is a bleeding which has occurred or a blockage, and rest of the treatment will depend on this. So if the patient has a blockage and you have brought your patient to the hospital within 4.5 hours, we have an option of giving an injection which will dissolve the clot, and this may make the patient completely okay. So this is very important to understand, that you have to bring your patient to the hospital immediately. If the patient has a bleeding, then the doctors will give some injections to reduce the blood pressure, and also the patient may require surgery. Okay. Other than this, the patient will need to be hospitalized at least for a few days, because the risk of complications is very high in the first few days. Also, the patient will require at least 3 to 6 months to start the recovery. So within first 3 to 6 months, recovery is maximum. After that, recovery happens more slowly. So during this period, the patient will have to do a lot of exercising, physiotherapy, etc. At discharge, your patient will be given some medicines in the form of blood thinning agents or some cholesterol drugs. Okay, and the patient will have to take lifelong. Right? So is there any way in which stroke can be prevented? Yes. There are 3 main reasons for stroke, that is hypertension, diabetes, cholesterol, and there are several other reasons, but these are the 3 main ones which you can prevent by yourself. That is, if you have blood pressure or hypertension, it is essential for you to keep a follow-up with your doctor at least 3 monthly, so that your blood pressure can be monitored. You have to take your medicines regularly. Many people tend to stop their medicines because blood pressure is alright, but this is not correct. Blood pressure medications can be stopped only by your doctor. So you have to continue taking them. You have to reduce the salt in your diet. You can avoid sprinkling salt salt on top of your food. You can avoid eating papads, pickles or other processed foods which have high salt. Daily exercise will also reduce your blood pressure and will help in your diabetes as well. Also, to control your cholesterol and diabetes, you have to make some dietary modification. Eat a balanced, healthy diet in the form that you eat small, frequent meals for diabetes. For controlling your cholesterol, you have to avoid oil, ghee, fried products, processed foods. Preferably, the food you eat should be prepared at home. And avoid eating out too much if you suffer from any of these conditions. So I wish you good health, and if you have any more questions or you need more information, you can contact me via Liprit. Thank you so much.